Hi everybody, Dr. Anjana Bana here, and welcome back to my YouTube channel. We have Dr. Ashley Naidu with us, an orthopedic surgeon from Midrand. Oh, cool. All right. So, and then I just wanted to have how do you choose? So there's a daily moisturizer, an ointment, as well as an enriched cream. I know, well, this is pretty popular with us, and we give it to patients, and we also prescribe, we mix it with a prescription retinoid. So for patients at home to use, for body use as well. So because it's so cost effective, so we actually give it to them as well for body use. And for young, my daughter uses this, so she's 10 years old. So for young kids, so it's a really nice moisturizer, say post-treatment for post-peel. So that's what we use it for. But how do you choose which one to,
that's a good question.
To use?
Yeah. So it's quite a diverse range in what it's used for. Okay, so the first agent we'll talk about is, or the first item we'll talk about is the postpartic ointment. This was originally developed with our dermatologists more for patients with dry skin concerns, with plaques and raised areas. Examples of this would be psoriasis, as well as patients with very bad areas of eczema that's not responding. Generally, the emollient inside here is jojoba seed oil and jojoba extract together with the postpartics, and it stays on the skin more oily for longer. So obviously, if you've got oily skin concerns, I wouldn't say this is the one you start with. However, when you have very dry skin concerns in those areas over your heels or your elbows and so forth in winter, this may be a successful use item at that level. As well as if you've got psoriasis lesions around the hairline and around the neck regions as well. It's quite a good product for that in terms of being an anti-inflammatory agent together with the emollient side of things. It's also got quite a common use now on the aesthetic side of things as a post-peel agent.
Very medium depth sort of peels.
And the basis of it is we've been seeing very good results with using it as an occlusive dressing. So more or less when you do a peel and when you're getting through those initial stages of the skin peeling away and you're bringing those sort of impurities to the surface and all of those things, this actually helps very well with trying to keep the good things that are being done with the peel inside. So it creates a barrier of sorts and still maintains this antibacterial activity. So you don't have to worry too much about infection or infection-related flares of existing conditions.
Especially with medium depth and deeper peels.
And then this one is the Enriched Cream. So it's a lot denser than the other preparations in this. It's got a patented carrier molecule inside this that we've coined DuraQuench, but the basis is it draws a lot of moisture into the skin. It does take a bit more longer for it to absorb into the skin, so you may find that it stays on the skin for longer. But this is more for people that want to simplify their routine. We always say that with the Enriched Cream, because it's something that can work on extremely dry skin concerns, if you've got very dry faces, then you would adjust to this for your face rather than the daily moisturizer. But we tend to use it more for body use itself. With the use of the Enriched Cream, we like to say that obviously with the denser preparation and so forth, the percentage active in this one is more readily available with that molecule bringing things in. And we like to say that before you try to use it on your face, try a bit of a test area on your forearm or something. Because it's a new active and it's using a new carrier compared to the daily, right? You touched on the daily being used with other actives. That's a good thing, right? So the thing I must tell you is that our use with the dermatologists have expanded, and there's quite a few agents that they are mixing into this in their practices, and they're using this as now a base in their practices. Which is again, it's a space that's growing, and the daily moisturizer tends to be very popular with people because it has a nice balance of shea butter in it, and it keeps the absorption very quick with this. So it's something that we do say portability counts, and we want you to reapply this during the day more often than the Enriched Cream. But the basis of that moisturizer is you don't want to have hands and face that is more oily or more product on it for longer. It irritates me as a surgeon as well. So I tend to gravitate towards that more for the face. And another use, we're not putting it out there in that market yet, but post-shave. It seems to be something that relieves shave burn quite effectively. It's something that the male audience have been telling us of recent, and has reduced the amount of those sort of shave-related skin lesions.
Oh, very
the scar cream we've touched on, look, this has the highest percentage of the active inside it.
Okay.
The reason why it's so small, everybody asks us this question, is that we've been greedy or something. The active itself is in the smallest size in this one, and the reality why we went for the smallest size in this one is obviously from safety concerns. We don't want you to have high volumes of a high percentage of an active, because we can't control what you do when you go home, but we try to give you the best advice about using it more on the body. If you have to use it on the face, again, the same applies. You're going to have to go with a test zone area first, away from the T-zone and so forth, and then see first how you react to it, and then you go forward. It can be used on the face. People have used it around the hairline. It can be used for surgeries, even the tip of your nose, wherever it is. But again, because of the high percentage of the active, you have to do it in a safe manner. In saying that, how long do you need to use it before you get effectivity on a scar? Everybody asks this question, so I might as well address it. Regular usage close to the time of the insult. So if you have a burn, if you have a cut, if you have a stitch, if you have a treatment, and you're looking at using this to recover quicker, we usually advocate for twice a day use, topically over that area, a pea-sized amount, and they're using this for a period of 3 months before we get to scars that we find are the best cosmesis we've seen in a while. Some people go on to use it right up to 6 months or even a year. The basis behind this is no adverse events. Look, it's dose dependent activity. This, so the moment you stop using it, you revert back to what your microbiome was doing. You've got to know this, right? So the basis is this is something is called paying it forward. You've got to use this over time to keep your skin healthy, and that's the message here. You know. There's a nice little tagline. I'm not going to claim ownership of this one, but I'm going to say this, that healthy skin's always beautiful. Is beautiful skin always healthy? You know, this is the other side of things that we try to look at. Is we do a lot of things to try and maintain appearances, and trying to restore the health while maintaining that appearance, I think, is a better goal to have. To look at getting back to what's normal.
You know what we say, form follows function. So it's a different way of saying it, but you know, we use it in faces and skeletal structure, and you know, nasal and mouth breathing. Also, the mouth breathing and nasal breathing also has an influence on your gut microbiome, but the structure of your face, and if it's properly structured through proper breathing, you function better in terms of, you know, besides breathing, posture, brain fog. So it's health first.
I think the last one I think I sort of
the soap
is the glycerin bar. I need to stop using the word soap a bit.
Sorry, what's it called?
Glycerin bar, right? Look, another question that came up, and again, that was a slip on our side to call it a soap. It doesn't contain any sulfites, parabens, or slays. So it's a pure glycerin bar that's been impregnated with the postbiotic. It hasn't been done anywhere in the world.
This
is something that we also found a way of doing, which,
South Africa.
Which was a bit innovative. But the basis of it is to use it as a cleanser. It gained a lot of popularity with the dermatologist practices on the basis of using it as a gentle cleanser, but delivering the action of the postbiotic in that as well. The action of it against those bad strains of Cutibacterium, right? I can't say all strains of Cutibacterium, because not all strains of Cutibacterium is bad. Right? So we're going into species level these days, looking at these things.
So that would be interesting to cleanse a patient with prior
So just to give you an example, in our practices, we tend to use this as the first agent people are washing around their surgeries with perioperatively as well, just to maintain this sort of antibacterial activity and bring it down inflammation as well. Because if you've got something that you're cleansing with, it's anti-inflammatory as well, you're maintaining the curve here. And we tend to find a lot of happiness with patients with quite bad acne lesions as well, using it as a cleanser, because it's mild and gentle, but still anti-inflammatory and antibacterial as well. And I think as a composite thing, people find ways to use this in different weird and wonderful ways. I mean, we found that our little sample tubes were being used as lip balm, and apparently that is a market for us to explore as well. But I mean, it's quite a safe agent. It's been tested quite extensively, from a 3-day-old baby right up to a 93-year-old, like we've said.
Yes.
We've been through thousands of patients with this. We've worked again with patients, with people abroad and here to look at the formulation quite a few times over before we were happy with it. And a lot of work has gone into it. It's been about a journey of about 4 to 4.5 years from a conceptual stage to actually having something in market. It's been in market for about 6 months. It's growing at a decent rate, and we're quite happy with the idea of it. Look, we were being typical doctors. We were selfish with it. We created it for our practice, and we thought that it was for a practice only. And now we realize, look, the amount of agents in our bin, if I can say it, as retail and so forth out there is very small that can play in this range with this amount of actives. Just to give you a snapshot, because I didn't touch on the other actives in this beside the lactosporin, but there's ceramides across the range.
Ceramides, niacinamide as well?
Niacinamide as well, which helps with pigmentation, and hyaluronic acid again across the range. You know, these are again quite costly things if you try to buy them in the percentages individually in certain products in the market as well. You know, and we try to stay true to the fact that the African pocket must matter. And this is what we're exactly saying, is that this has to be something that reaches as far as a toothpaste can reach. It has to be something that reaches as far as the northern, the eastern, the western, and the southern tips of this continent. We want this to make a difference here. And the point behind it is once we start to look at uneducated ways of marketing, and this is exactly it. Like, we didn't want to go for the fanciest packaging or so forth. You know, we went for recycled cardboard and 96% recycled polyurethane. We sourced it from a single manufacturer. We took a long time finding the right priced one that could work for us, just so that we can reduce that being the reason to pay more. Much in the same way that the marketing style that we've been with is very conservative, considering what we're doing here and what we're saying with a first of its kind in the Southern Hemisphere type of product. And competitors in the Northern Hemisphere are a factor of 10 times our value in terms of a single item being bought. So it's to try to be the first, and we knew that we were. We had this idea years before even this was breaking news in a lot of different places, and it's about that. It's about staying true to us as practitioners, being true to our patients, being true to our public.
Oh, cool. Thank you, Ashley. Thank you for this extensive knowledge, and thank you for breaking this down as well. It's and I appreciate your time today. So thank you for joining us.
Thanks for having me.
So, anybody, any questions, you can drop it in the comments down below. Also, have a, they can find you guys
look at our Instagram page.
On Instagram, they've got a website.
A website as well. There's an online store, and there's quite a few stockists on there as well, including Anjana. So you'll be able to find where you can have a touch and a feel of the product if that's what you need.
And ask questions. Ask as many questions, because it is new. It is something, because people are all about razzmatazz, and this has substance. So I think we have to be a little bit more about substance sometimes. So any questions and comments, drop them down below. Like, share, and subscribe. Bye, guys.
Bye, guys.